Well, Republicans fuss about the details of Austrian economics and worry about tariffs. The U.S. border is getting closer and closer to total and utter collapse, and that's not hyperbole. Last May, the Border Patrol apprehended the highest number of illegal border crossers in 13 years. This has massive consequences for the country that we're not talking about. Tammy Bruce is thinking about them, though. She's a radio host and president of the Independent Women's Voice, and we're happy to have her on tonight. Tammy, thanks very much for joining us. So walk us through what you think some of the more obvious ramifications of this border collapse might be.
Well, we already know in the broad sense, and we've had this conversation for years, about the problems people face on the migrant trail when it comes to sex trafficking, when it comes to the coyotes, when it comes to sexual assault, et cetera, the problems that children face as well. And then what happens in the aftermath when people are here in the country, the Kate Steinle situation, individuals who are being protected in sanctuary cities, criminal illegal aliens. But the fact of the matter is, this health crisis is an element that no one's really discussing. The team at Independent Women's Voice, as you noted, I'm president of, has determined that our own government, when we've been talking about, of course, infectious diseases like measles, we thought we eradicated it. We're on track now to the end of this week at probably at about 1,000 cases in 26 states. Typhus is moving through Los Angeles. The CDC is now warning about tuberculosis. We have new outbreaks of Ebola, certainly Zika, that's in Congo, Zika in Brazil, et cetera. And what's not being dealt with here is the fact that you've got 144,000, as an example, moving across this border, none of whom, of course, we know if they've been vaccinated. We hear the admonition appropriately about the importance of vaccinations. But what we've also determined, Tucker, is that the CDC only requires proof of vaccination for people applying for migrant visas legally. If you are trying to enter using a non-migrant visa, the temporary visa to visit, you are not required to show proof of vaccination. So it's an interesting ball that's been dropped at the federal level. And then, of course, at the border, the chaos here is certainly we're worried about American families and their health. But the people almost at the front line who are extremely vulnerable are the migrants themselves. The Border Patrol announced last week that they've captured about a group of 161 people from Africa, Congo, Angola, et cetera. And of course, Congo now is dealing with another outbreak of Ebola. Imagine with these kinds of groups merging, individuals coming in from Brazil with Zika, families coming up from El Salvador, the mix of what these individuals are facing in the caravan, and then when they're placed in communal areas or end up homeless in cities where the infrastructure's collapsed because there's so many. IWV has started a petition. This is our news for today. Something has to happen. We've launched a petition, IWV.org, telling the White House that we must redouble the effort for border security. Beyond all the other political issues we've heard about on this issue, this transcends that. This is about every family and every human being caught up in this chaos. Thank you. It's important. Thank you, sir.